aspect of chiropractic and upper cervical in general is that some people may not know is the history of it, and the fact that upper cervical has been around for over 100 years. And in fact, chiropractic was discovered in 1895 by a natural healer named D.D. Palmer in Davenport, Iowa. And he was having a conversation one day with his janitor, a man named Harvey Lillard, who was talking about how he had just all of a sudden lost his hearing 17 years prior. And so D.D. was kind of baffled by that, and so he started asking some questions, trying to figure out what could have caused it. And Harvey said that all he could remember is he bent down one day to pick something up, and he heard a pop in his neck, and all of a sudden his hearing went away. And he didn't really know what it was, so he just kind of moved on. But D.D. wanted to look further, figure out maybe if he could find something that could have been connected to it. And so they went up to his office, and he did a physical exam on and was examining his body, and he was feeling on his neck, and he felt a big lump on one side of his neck. And so he just put some pressure on it, and he heard a popping noise, and that's all he did. And so he said, well, Harvey, I want you to come back the next day, I'm gonna check you again. And he found that same bump, and he pushed it again, and after the third time of doing that, Harvey's hearing came back. And so D.D. thought he had found the cure for deafness, and so he started sending out newsletters and advertisements all over the country saying that they found the cure for hearing loss. And so they had people traveling from all over the place trying to find some help for their hearing problems. But what they were finding is that not everybody's hearing was restored. But what they were seeing is that some people's digestion changed, their headaches went away, their bronchitis went away, or whatever their condition may have been, different people were being affected differently by the adjustments that they were making. And so D.D. really was pushed to dig further to figure out what exactly the mechanism was that they were dealing with when they were making these spinal adjustments. And so they really got pushed to do some research. So his son B.J. Palmer stepped in. He's actually known as the developer of chiropractic because he wanted to do the research to make chiropractic more scientific, more reproducible, and to really understand what's going on when they were making the corrections to the spine. And so he started a research clinic in 1935, and it was worth over $1 million, this huge facility. But he wanted to be able to do top-notch research, and so he's actually the first person in America to use X-ray to take pictures of the spine to actually see inside the body. And he also had tools to measure the nerve system. But what they did is they started out because they figured if they adjusted one area of the spine, why not adjust all the areas of the spine to get better results? So they started out adjusting the spine 3 and 4 times up and down each day, and as they moved forward, they tried to do less and less to really pin down which area of the spine was most important. But during that, as he was teaching different principles, other chiropractors would break off and start teaching their own schools or open their own practices, utilizing the research they'd already done. But as time went on, they realized that the less they did and the more they focused on the upper cervical area, the bigger effect it had on the spine and the body as a whole. And so the research continued until 1951, and then BJ stepped down and went into retirement. And so at this point, chiropractic, there was a lot of different approaches to the profession. And so, but upper cervical was just one of those. And so it kind of died off a little bit after BJ stepped down. And so we didn't really hear about it for a while. But then as more and more doctors started doing the upper cervical work, we started getting more patient testimonies, more stories. Upper cervical has really become a little bit more mainstream in the profession in the last 10 or 15 years. You see a lot more chiropractors moving in that direction. We even have patients doing documentary films. They're spending hundreds of thousands of dollars of their own money just to spread the word about what we do. And there's just more and more research that comes out that validates what we do and explains why our patients are getting well. And so that's why we do what we do here in our clinic, is because we truly believe that our patients deserve to be healthy and to have their highest God-given health potential, and we're able to do that through upper cervical.